Hello, everybody. We're going to start the meeting, and thank you all for coming. We're really excited to see different faces. So with that, why don't we go around the room and introduce ourselves, and we'll start with this council man over there.
I'm John Cryer. I own the Real Market. I own a shop in the jail leadership building.
I'm Julia, the local clock in the field, looking in Mount Mary Business.
Hi, everyone. I'm Dr. Neil. I'm with AC Chow, the board director, so happy to speak.
I'm not Julia Gonzalez. I'm with the co-op and I'm my name is Danny Fetus. I'm the division director of environmental.
See the little guy. You guys can see that? That's nice.
My name is Danny Fetus. I'm the director of environmental health for Business and Health Departments.
I'm Rachel Johnson, and I am the Deputy Health Director for the County Health Department.
Morning, I'm Suzanne Engel, Prevention Services Director.
Well, good morning. My name is Isaac Wilson, the founder of the Knowledge from Chief County and also the Department of Health.
Now, let's see that you are, and
Epidemiologist.
it's really lucky to have Cochise County, because a lot of people don't have one. So, you know, Cochise County is out there really well. Start and I'm the school superintendent.
I'm Kendra Allen. I run a religious prevention program at the County Health Department. I'm Angela Sullivan, and I'm in the health services specialist for the county.
My name is Kelsey Benson. I am the program manager of Clinical Health Services for Sheriff.
William, the manager of Health Center Operations. Keep going.
The health services. Kevin Gomez, Supervisor 2.
Barb Lane, County Health Director, Cochise County. Good morning, I'm Tara Beckman, the Administrative Assistant for the Health Department.
Lanny Cole, Sierra Vista.
That's. Was it?
I didn't want to look on the service, so unfortunately, because of the office.
Glenda Trevino Fletcher, Copper Queen Community Hospital.
I'm Dr. Eric McLaughlin, County Public Health Medical Director.
Charlotte Taylor, Northern Cochise Community Hospital.
Denise Salisbury, Southwest Cancer Care.
Helmut Elsotag, Health Department, Public Fiduciary.
Regan Durfus, the Cochise County WIC Director.
So I'm calling Lawyer, our Behavior Society, so we not only do the development, we work with this part of my fallbacks, but I'm really excited that, you know, absolutely, that's, I was like being president of and value for patients, so I really thank you all that are online for attending. This is a pretty good turnout, I would say. Right, this is your meeting. So we are going to be meeting every 2 months instead of every 3 months to decide because there's just so much going on in the healthcare world. And so being more connected and having all these engaged with people and it's something that is within itself. So with that, I'm going to turn it over to Barbara Lane and proceed.
Okay, thanks. So I'm going to talk about Peers Health. It was a labor of love of mine. It took 1 year. I applied for a grant, and I'm going to take those posers if they're interested before they leave. And Karen, if you could pull it up on the screen for those of you who are online. Here's Health was something that I thought through. I had this idea when I first moved to Arizona, and I came over to Disney. I had to have a colonoscopy. At my age, I was due. And so, one of the things that I did is I took off the day of work from the health department. And I told folks, I'm not going to get work because I need to have this procedure done. And what happened is people said, oh, are you going to Tucson? And I said, no, I'm going to get done in Disney. And so I started thinking if the health department didn't know that we have a colonoscopy in Cochise County, and there might be a lot of people in Cochise County that didn't know. So with that idea, I applied for a grant through Arizona Community Foundation, and our board was extremely supportive. And the idea came from there. So we worked with a marketing firm to do a marketing campaign. And every single person in the ads in Here's Health are local folks. Some are from Douglas, some are from Dragoon, some are from Bisbee, some are from Fort Pachuca, some are from Sierra Vista. They're all local. They're not paid models, even though they look like them. And it's a search engine that you can find any possible level of this in Cochise County, absolutely free at no charge. You don't have to register, you don't have to put your birth date in, you don't have to put your name in. So let's say you want to find a dermatologist, so you don't know who to go to. You can search dermatologist in the search bar, and it can pull up all the dermatology offices. You can put in where you live, and it will match to your phone. So you can either, and there's posters everywhere, scan the QR code for it to pull up, or if you don't have a smartphone, you can enter in your website, www.here'shealth.org. Or you can go on the health department website and pull it up. But it's a wonderful resource for folks. It's free. And my thought is, a lot of folks live in our off-grid communities. They live off the grid. You don't have any people close by. Or they can say, hey, a dermatologist I can go to. So this is a great way from the privacy of your own home to find these services and find them local. Why is it important to keep it local? Because if we keep it local, the money stays here. If the money stays here, it goes back into the community. I love Tucson, and I recognize sometimes I do have to go there for certain services, but if I can get the service here, I'm going to. Because if I go to Tucson and I get the service there, who do you think gets the money? Tucson. So this was something that I think was a long time coming. We got some great feedback on it, and the board allowed this to transpire, and I'm so grateful. They were very supportive. So I would encourage you to tell your friends and family that Here's Health is a nice opportunity, and you can find services close to home. About the commute. You don't have to have childcare, you don't have to take all the time trying to work, you don't have to read your agriculture. So this is a great service that's free, that you don't even have to register for. Yes, ma'am.
So one of the things having, 92-year-old mom who has a smartphone, doesn't even know how to do QR code, is very anxious. And I know several other older ladies in Douglas that live by themselves. And they don't know how to do the phone, right? Is there ways or caregivers, could they be given a list of phone numbers? Or is it just such a big directory?
It's such a big directory, that would be very hard, and then you couldn't map it to your house. But anybody that's interested, we have 5 clinics. You can come into any of our clinics and we'll do it for you.
Okay.
So if somebody doesn't know, they can just walk into the health department, we'll pull it up for you. The partners in this endeavor are Chiricahua Community Health Centers. We have Northwest Hospital in Wilcox. We have the Copper-Queen locations, and we have Canyon Vista Hospital, as well as TMCs. So there's a lot of information in here, and their affiliate satellite offices as well. It even includes, for instance, there are urologists that come from Tucson that do visitation at TMC in Benson. It even has the visiting practitioners in this directory with the hours and days they come. So that's nice too, because if we don't have the physicians here, a lot of these sites have reserved from Phoenix and Tucson that provide these medical services.
Yeah, excuse me, because I'm still so new. Aging comes under the Department of Health, right?
Yes,
Okay,
yep, rehabilitation.
and I'm wondering if we can't also the next year to look at a way, especially when I think of McNeil and Double Adobe, we have really elderly people that are isolated out there. And I know John is kind of like the main gathering place for the greater McNeil area, especially McNeil. And maybe we need to start thinking of putting information in a place like this place that he would be willing to do it. Because I know we've had, yeah,
Few single elderly in my area.
yeah. And there's quite a few others, and some that aren't getting care, people who come, but maybe in churches would be another way of, if we could put this information in churches, because I know of the few elderly women that I know that don't go to the library, because sometimes it's just hard for them to get in and out of the car, but they do go to church. That's what I think they go. So maybe I'll take some of that and then I can drop it off at the different churches.
That sounds great. Anybody who wants to take some at the end today, feel free to, print them out for you here at the Department of Health. I am working on an aging initiative with CEDO, the Southeastern Area on Aging, and we're going to be doing some combined calendar work. I'm going to be working with ASCHOW to really get out there and do some senior education. So we've got a lot of things in the works over the coming year. Does anybody have any questions about Here's Health? Yes.
In Spanish?
It is not in Spanish yet. We want to translate it. It is not. No, that's a great point. That's something on our list. Yes. Yes, yes. Let me check on that and see where we're at with that. That's a wonderful point. Thank you. Anything else?
John, can I ask you, how do you think this would help you in your community?
Pardon me?
How do you think this could help you in your community?
Well, I know several women that need it right now. But they also need the education on how to use the phone and the computer, which I want to. Hopefully I can get the old school, McNeil School, and we could give little classes there. Yes, the university gives classes, but they got to drive 25 miles to get to class. That's either way to go, and they're not going to do it. But they had something right there. There's a big group of elderly people that would be interested in learning how to use the phone. I know everybody knows how to use the phone. I'm not going to pay the phone myself, but teach them how to use the phone and just become real easy.
Yeah, I think we have some partnerships that can definitely accomplish that. I know some of the folks online are saying they're having a hard time hearing, so if you could just kind of elevate your voices, that would be very helpful.
Yes, Jane?
Ms. Barber, if I can mention our libraries just launched a completely free program in all of the county libraries for adult education on exactly the kinds of topics you're talking about. It's basically that's.
Well, then we need to show them the difference, because the library is 25 seats. McNeil is out on Mars. It's out there. And if it wasn't for Ms. Gomez, we wouldn't even be noticed today. So I tried my best. I've been there 22 years running the local store. And then Jillian and John moved in, and we have a little thing going there. But I think the education has to be in that area. Simple class, you could get them to go to it, or you could go to them if it's out of there.
So maybe that's something we can work on.
And they will not go 25.
Yeah, no, they know.
If they can't, and they will not.
I feel confident we can get you something.
Yeah.
Pardon me?
I feel confident we can get you something.
Yeah, well,
We'll work on that.
okay, terrific.
Great. So Justice and Care Collective was a initiative that was started in Bisbee in October. And we just held it again in Sierra Vista the other day. And it will be in Douglas next. And what it is it's a collective movement that involves the county attorney's office, the local police in that area, the Bar Association, and one of the Superior Court judges and Justice Court judges have agreed to donate their time. Anybody who has a misdemeanor warrant and we have folks that speak Spanish there that are bilingual. Anybody that has a misdemeanor warrant can come and get that warrant quashed, which means waived. So petty theft, petty shoplifting, misdemeanor DUI, misdemeanor DV, misdemeanor loitering, camping, public intoxication, misdemeanor, no felony, only misdemeanor charges. The idea is that we're being tough on crime, smart on resources. So folks that need to be incarcerated are filling up the jails, folks that are engaging in violent crimes, and the folks that have misdemeanor issues, maybe due to mental health or substance use, can have that warrant waived. And then when they come out from having it waived, I have all the resources available. We have sober living homes, we have mental health treatment, we have residential treatment for substance use, we have Arizona at Work, we have NAMI, the National Association for Mental Illness. We have a large gamut of resources and providers there to assist folks. And so we had it yesterday in Sierra Vista. It was very successful. We'll be having it in Douglas the next quarter. I'll be sure to make sure everybody gets that information. It will go on our website. We post it on social media. And this is a nice opportunity for people to get a fresh start. In fact, I just got a message from one of the law enforcement officers in Sierra Vista that said there was a woman who really fell on hard times. She had a misdemeanor for public intoxication. She had that warrant waived, and she now is able to secure going back to school and getting a job. She was very grateful. So it's a really nice opportunity for the public to come out to learn about resources. The McNeil Co-op, the local co-op was there providing people with fresh produce. A lot of folks came on SNAP, and that way they were able to get those double benefits. So we're going to be doing that in Douglas. We'll do it right here in this building. I will keep everybody posted. I'm going to be talking to the city of Douglas about using that parking lot, so we have plenty of parking because this area is a little bit tight. But I'll keep everyone posted. But it's been a nice initiative. And people are very grateful for that fresh start. You know, everyone makes mistakes, and we want to address those and let people know that they're not going to be judged for that we can move forward.
I should put some notices up right here in the court.
Absolutely. We're talking to Judge Anna.
And so do they know how many misdemeanors that are out there, or?
Yes, they do have that data. Sometimes people are still afraid to come in. They think it's a little good to be true. But now that we successfully have one in Bisbee and Sierra Vista, the word is getting around very quickly. That it's not a trick, that you can walk up, you can have those warrants waived. And there are lots of folks that speak Spanish, so language is not an issue. And we have attorneys that will help if somebody can't read or write, which we've had that situation. We have attorneys that will help with that.
You're connected in the community of Douglas with Spanish speaking, right? I wonder if it wouldn't be worthwhile to go like Univision, like the radio stations.
Yeah.
That I guess it's an AP, right? There used to be one here that was Spanish speaking, but even if they're an AP, because so many people over here listen to, whether it's Spanish,
That would be great.
radio, if we couldn't announce it over there.
That would be great.
Yeah, sure. We could do that. We need to start growing a kind of communication system here in Douglas, because Douglas to me is one of the, of all Cochise County, maybe, it's really hard to get the information, and it's really hard to get it out. And I think as I'm starting to try to be more, bilingual and listening to it, I realized that's a pretty good radio station over there.
Yeah.
And a lot of people, they talk about Douglas, so we need to maybe look into bringing them into the circle.
Sure. One of the other great things about this event is no matter where your warrant was initiated, anywhere in Cochise. So if you got a warrant in Bowie, it doesn't matter. These judges can do the whole county. Can't do Pima County, we can't do Maricopa County, but if you have a warrant anywhere in Cochise, they can waive it here in Douglas. So that's the great thing. So we have a lot of people that travel to Sierra Vista, Bisbee, that have caught a warrant somewhere in the county. Doesn't matter. We have someone from the Justice Court, we have someone from the Superior Court, they can take care of it. Some people came and they received expungements. They had records that they wanted wiped. They did that too. So you can get expungements, you can get your warrants waived, you can see a medical provider for free. There'll be lots of resources there. It'll be a good day. So we do it about half a day. We work on the judge's calendar. So as soon as I get their availability, I'll start putting it together. We'll get the date on the books and I'll let everybody know.
That sounds good.
All right, any questions on the Justice and Care Collective? Any information that I didn't cover or that someone might want to know? Okay, hopefully they're not coming to get me. All right, Dr. McLaughlin, Dengue, tell us what dengue is.
Yeah, and I believe Ms. Taryn has some slides ready to
And
help
if you can
visualize.
speak up, sir, as much as you possibly can.
I gotcha. I believe Ms. Taryn has some slides to help visualize, correct?
Yes, I'm just bringing them up right now.
Awesome. Well, I'm going to talk a little bit about dengue fever. It's not a big, giant concern, but I just want everybody to be aware of what this is in case you hear about it, and more importantly, how we can stop it from being a big problem in our county. So dengue fever, and next slide, please, Ms. Taryn.
Can you guys see that? Oh.
Awesome. Looks great. All right, Ms. Taryn. So dengue is a viral illness that's spread by mosquitoes, and it's been around in the world for hundreds of years, predominantly in Asia, Africa, Caribbean areas. In the late 20th century, it started becoming much more of a problem globally because people were traveling and moving around from one place to the other. And the term dengue fever actually means break bone in Swahili, because one of the hallmarks of having dengue fever is that you have these profound muscle aches along with the fever. So next slide, please. Can you hit the next slide, Ms. Taryn? Thank you. So this is a viral illness transmitted by mosquitoes. And I want everybody to start thinking about mosquitoes as flying hypodermic needles that can transmit illnesses. Malaria, dengue, chikungunya, Zika, West Nile, all of these are hot mosquito issues. This is one in that same family. There are 4 main types of dengue, and if you get one of the types of dengue, you're immune to it for life. But the problem is, if you get a second infection with a different type, you can have a worse, more profound and serious infection, okay? Understanding which types of virus are circulating in our community is also important for us epidemiologists to know what we can expect if someone gets sick. Next slide, please. All right, so dengue is transmitted when you're bit by a female Aedes species mosquito. It doesn't really spread from person to person like the cold or measles or those other common illnesses we see. This is transmitted from the bite of the mosquitoes. The mosquitoes typically are day biters. Unlike the ones we see at dawn and dusk, these like to get you during noon and midday. Urban environments with water are what we're really focused on, because part of the mosquito life cycle is they lay their eggs in standing water. So containers, water features and fountains, buckets, clogged gutters, tires, anything, little drip catchers for plant pots, anything that can hold standing water is a perfect place for a mosquito to lay eggs. And the more mosquitoes you have, the higher risk of getting bit you have, and that increases your risk of getting dengue fever. Next slide, please. These are the 2 main species of mosquitoes, but they're all in that family of Aedes species mosquitoes. They like warm tropical climates. They carry other viruses as well. But the big thing is mosquitoes aren't stupid. They go where it's nice. They're in the Caribbean, Latin America, Central America, Southeast Asia. They like warm climates. They like urban environments, and they like standing water. Next slide, please. All right, so as you can see, they like to go where it's nice. Arizona, California, Florida, Hawaii. These are all places with Aedes mosquito living area. So they like to live in those really good parts of the world. And where those mosquitoes are, dengue usually follows. Dengue is not really being transmitted in Cochise County that much yet or in the border area, but it is across the line in Mexico. In the state of Sonora, they have a lot of Aedes mosquitoes and they're having a lot of dengue activity. So a lot of the cases we're seeing are vacationers who go across the line or they go back to visit friends and family and they acquire dengue and then bring it back and are subsequently diagnosed here at home. Next slide, please. Dengue's in 100 countries. It's most commonly in the warm countries. Southeast Asia, again, the Pacific, Latin America, and now it's moving up into Northern America as we start to see climates getting warmer and making that a really good area for those mosquitoes to live in. Next slide, please. All right, so how do we avoid this? I'm going to say this over and over again. If you're not getting bit by the mosquitoes, you can't get sick. All right. So to put on your skin, I recommend DEET, 30-35% DEET bug spray all over your skin. You can use picaridin, eucalyptus, oil of lemon. Any of these are acceptable things to use to keep the mosquitoes away from biting you. Also, we talk about a mechanical barrier when you're outside doing yard work or hiking or being around these standing pools of water where mosquitoes live. Long sleeves and long pants. They're kind of like a little mechanical barrier that the little mosquito noses can't poke through and bite you. In your home, using either your air conditioning and keeping your windows closed, using your coolers, and keeping screens on your windows to keep those mosquitoes out. You can also apply a chemical called permethrin, not to your skin, but to your clothing. So you spray this on your shirt and your pants, on your window curtains, to keep the mosquitoes away from you as well. This is especially important if you're going to be active during those daytimes, and especially if you're going down maybe south of the border to Sonora, where the mosquito activity is a lot higher. Next slide, please. All right, so how can the community help in this? We really want to fight a battle against destroying these mosquito breeding grounds. Make sure you're flipping over your standing water containers, plant saucers, buckets, trash can lids, tires, water features, dog and kitty water bowls. All these things are great areas for mosquitoes to lay their eggs in. Flip them over every now and again and put some good fresh water in there. Make sure your gutters are clear and you don't have water standing after the monsoons. And ensure if you're storing water, make sure it's got a good cover on it so the mosquitoes can't get in there and lay their eggs. Controlling how these mosquitoes breed is very important for us, interrupting their life cycle. And again, if you're not getting bit, you can't get sick. Next slide, please. All right, so what does dengue fever look like? This is really a high fever, like 103, 104-ish, big numbers, like 39-ish. You may have a little bit of nausea, vomiting, and that really profound muscle aches that is characteristic for break-bone fever. As far as treatment goes, sadly, we don't have much. There's no real antiviral therapy. There's no real vaccine. We don't have much to treat this. It's always what I call, what your parents told you when you were little kids. Stay home, stay hydrated, rest. And if you start having problems with bleeding, this is the hallmark of your dengue virus getting worse. When you're brushing your teeth, you start to get some blood from your gums, or maybe you get some nosebleeds. This is a sign that your blood is not clotting very well, and that is a sign to go and talk to your doctor, okay? Next slide, please. All right, so what this does is a bad dengue fever infection can lead to bleeding problems. That leads to problems with how your organs function, and these often require ICU level of care. You're going to be staying a night or two in the hospital, having a team of doctors and nurses working on you to make sure you're getting enough fluid and not bleeding too much. early recognition of this is important, and making sure that you get in to seek some help with your doctor or from your clinic is the beginning step. And I'm going to say before that step, if you're not getting bit, you can't get sick. All right, next slide. All right, testing. We've got great tests for dengue. We may not have good vaccines and treatment, but we've got really good tests. Most all your clinics or your labs can do the basic testing. It's the classic PCR test we always heard so much about during COVID times, that is amplifying the DNA of the virus and allows us to say, yes, you've got it, or no, you don't. It's very useful, but your doctor's not going to think about ordering this test unless you're communicating, hey, I got bit by a bunch of mosquitoes last week. I'm worried now. I've got muscle aches and fever and a little bit of bleeding and from my gums. You need to give these clues out to your doctor. But if you're not getting bit, you can't get sick. All right? Next slide, please. All right. So dengue is a mosquito illness you get with a lot of impact public health-wise and clinically. Controlling mosquito breeding grounds, not giving good standing water areas for those mosquitoes to breed is important. Recognizing if you have risk for being bitten by the mosquitoes, you start getting those hallmark symptoms. We don't have any really good treatment, but we can keep you from getting worse in the right setting of a hospital. And pay attention to the public health department, because we talk about dengue a lot and what kind of activity is going on at home in Cochise. Next slide, and that's it. If anybody wants to read more, these are some great resources for learning a little bit more, and I'm happy if anybody has any questions. Thank you for the time.
And Dr. McLaughlin, I know we talked about standing water in your presentation, but also spitting refuse, garbage, trash, rubbish. That's also a concern, correct?
Yeah. You know, you're looking at, I want to call it a clean environment. You don't want standing water. You don't want piles of decomposing trash. You don't want anything, I don't want to use the term dirty, but things that mosquitoes and bugs like. And we're really focused on mosquitoes. We're really focused on standing water, and standing water can sneak in a lot of places. Like I said, I had my mom go around the house the other day, and we had really good control over the dog bowls, and all the flower pot drip containers were all taken care of, but the gutters were clogged. And there was 2 knuckles worth of water up in those gutters. So we had to drain all those out. These are great examples of ways you can look around your house and make sure you're not making a good breeding ground for mosquitoes. Good question, ma'am. Thank you.
And Dr. McLaughlin, also just standing tires and old appliances, those also are breeding grounds, correct?
Yes, ma'am, 100%. Anything that can catch water, and you don't need a lot of water, you just need a very thin layer, because those mosquitoes are going to put their eggs there. Couple days, a week later, those mosquito eggs are going to hatch, and now you've got tons of these flying hypodermic needles around your neighborhood that can infect other people. Yes, ma'am. Clean, tidy neighborhoods.
And this is on our website. Will this be on our website?
Yeah, we'll post this meeting with all the PowerPoints on our website with the Cochise County Health Department. And then if you have trouble finding it, you can email me directly.
Do we have any community awareness going on around dengue?
We do. We posted a lot. You want to talk about the efforts that you took in Douglas?
Well, yes. One of the problems was that Pruitt had an incredible amount, and Axel had done a report about that we had a high level of West Nile virus. And it was when we had all those rains, we had such good rains July and August. And what happened was there were so many tires in Purteville and appliances and, just a lot of trash. So what we did is we did a cleanup. We told them I would provide, really, I think I did 4, 2 for tires and 2 for trash. And we had a cleanup day. I had a town hall meeting. And the best way in Douglas to get information out was literally putting a flyer on every car and every door. Because in Purteville, it's an Asian community. There's no way for anyone to get information. So I did that. I got about 65 people show up, which is a really, pretty good for a town hall meeting. And I said, listen, I'm giving you the opportunity free of charge. It cost me about $3,000-4,000. But I put up these dumpsters. You can come, bring all your tires, your appliances, whatever, and then you can get rid of the trash. And then going forward, we're going to have to start enforcing our codes. But just them understanding that having all this stuff around, we were West Nile virus. There were 4 or 6 different mosquitoes that had diseases that were in the community. Axel, do you want to just mention some of those? Because I was amazed.
Sure. So we set a trap, and then I was concerned about the West Nile, the Culex, which then could start branching off into different species. But that's a general group. The Culex mosquitoes are going to start transmitting to West Nile, and then as Dr. Ray just explained, the Aedes are going to start transmitting to dengue, which we've had a few cases across. So they're here. They don't respect those borders if I ever have them. Yeah.
So that's the way, I mean, one of our goals, although amazing, it does cost money, is cleaning up Cochise County. So I'm starting in Porterville, and I went back there just this past weekend just to see, and it's still very, very clean. I mean, it was like a total different community. Now, next step, I want to do Bay Acres, Washington Avenue, because when it rains, there's a lot of water that collects on the road, and then there is a lot of tires, a lot of appliances, a lot of everything. And so I'm going to have to do the same thing with them. I'm going to give you a chance, get rid of all your trash for free, but knowing that we now are going to step in and start enforcing our codes. Because that's the only way, I mean, you want people to have the ability to be free, and not have us tell them what they can have, but at a certain point it does become a health issue.
Right. Yeah, as far as government, a lot of people take it upon themselves to clean up the trash, and it costs money to go to the dump and clean up somebody else's trash. Because some people, because there is no dumpster, because people dump stuff when because they left on the property, in the alley, on the street, and so people take it upon themselves to go and do that. It costs money. It's not free to dump whatever.
And the problem is that as a county supervisor, I don't have authority in Douglas. Bay Acres actually is in the county, and Porterville is in the county. But maybe the next time what we should do is invite the city of Douglas, to talk about this, or maybe we can have a separate Douglas Health town.
Sure.
Invite, and we can come in county, tell them what we've been doing and what's available to them, and ask the city of Douglas to, participate so they can help spread all the information. I know that once a year, I think we provide, you can come and dump for free. You get a little card in the mail, but maybe the city of Douglas can watch out too. And maybe we could do it in partnership. There's a lot of things we could do, but we got to sit at a table and start discussing. So thank you, Dr. McLaughlin.
Thank you for having me, and great stuff with those cleanups. This is it's not a city or a county problem. This is a human problem, and just it's kind of our species against the mosquitoes who like to fly around and drink blood and infect us. So thank you for all that great work you're doing out there in public health for us all.
Great, Kendra. I need you to speak loudly. Okay, I'm going to do my best. Okay, so today I'm going to talk about local drug trends, emerging substances, and how we respond to those things as a country. Next slide, Tara. Just oh, sure. Begin.
That's the top one. So
This one. Okay. This is where we get our information on drug trends and emerging threats. Our best source are people who use drugs. They are the experts of what's going on here. We also get information from organizations and entities that service or encounter folks who use drugs. Behavioral health, street outreach, Law enforcement and EMS also give great information. They're very good at spotting trends or noticing patterns. We use our Cochise County Overdose Fatality Review Board for information. And then for emerging threats or substances coming in, we participate in the National Early Drug Warning System, and we're part of the Opioid Response System, which is a public health, public safety partnership. So for our purposes today, I'm defining drug trends as substances that are already present in the local supply, but they may change in form, in concentration, or in the way folks use them, and it's identified through local sources. Emerging threats are either new substances or substances combined in a new way that we haven't seen before, not widely spread throughout the county, and we use early warning systems for that. We also use information from Canada, from the UK. Surprisingly, as a rural community, we have an advantage with emerging threats. When these new substances hit the US, they start at the coasts, they come in through major cities, and then trickle down to rural areas. So by the time we see them, there's literature on this, protocols on signs, substances, education, best practices. We're weirdly fortunate in that way to be a little bit removed. So the first drug I'll talk about is fentanyl. For anyone who doesn't know, fentanyl is a synthetic opioid. And on the illicit drug market, it's 50 to 100 times more potent than morphine, which is an opioid used in hospital settings. For the last couple of years, the illicit fentanyl has looked like this. These are counterfeit hydrocodones, or oxycondoms, I'm sorry. And they've been this pill form. In the last several months, we've seen a shift from the pills to powders. You can't find pills as readily anymore. You'll get baggies of powder. The powder one appears to be more potent. And for folks using, it's harder to gauge how much you're using when it's already in a powder form. So there is some increased risk for overdose just with the change in texture, I guess. Another trend we're seeing is that more folks are injecting fentanyl than they have in the past. Historically in Cochise County, the predominant method of ingesting fentanyl has been smoking, but in 2025, we're moving back to IV injection. Using fentanyl at all carries risk, it's dangerous, but there are additional risks that come with IV injection. Abscess, infection at injection sites, and if we're talking about sharing syringes, HIV, Hep C risks. Our fentanyl here has been off and on contaminated with xylazine. Xylazine is a veterinary sedative. It is a large animal sedative. Cattle, horses. I think the saying is like enough pills to knock out a horse. Xylazine is the drug that knocks out horses. So it has tremendous effects on the human body. Mixed with fentanyl, it's a double whammy of sedation. Xylazine it causes very specific deep tissue wounds. So hospitals, clinics, and street medics, they're able to recognize xylazine in the supply just by the wounds coming in. There are a couple additional risks with fentanyl. There's been some consistent online chatter about a national supply disruption. Anytime that people can't obtain their usual substance in their usual way, they tend to seek out riskier substances, a riskier combination of substances, and obtaining them in less safe ways. So we'll see if this materializes, and we will watch out for it. And it's important to know that fentanyl is probably present in any illicit pill or powder that you obtain. And then those pictures are small, but that's counterfeit Adderall versus actual Adderall. The white is an actual Xanax bar versus the counterfeit. Almost identical, very hard to spot. And the counterfeits almost certainly have a little bit of fentanyl in them. sometimes enough fentanyl to cause an opioid overdose. So people don't even realize they're consuming an opioid and experiencing an overdose. Methamphetamine is the next drug I'll talk about. In Cochise County, fentanyl and methamphetamine kind of teeter-totter as the most prevalent or the number one choice. 23, 24 methamphetamine took the top spot. 25 fentanyl is the number one drug, but methamphetamine is really close. Methamphetamine is a really strong stimulant. Speeds up the brain, body, provides lots of energy, takes a toll on the heart and the vascular system, and it can also produce feelings of anxiety, paranoia, psychosis. Methamphetamine normally looks like this. It's shards of broken glass is a good way to describe it, really jagged. In the summer of 2025, the local methamphetamine was described as a lot weaker and more powdery. It appeared to correct itself by fall of 25, but we pay attention to this stuff because word gets around. So if Marissa and I are both methamphetamine users, we'll say, and I say to Marissa, the meth is weak. I'm having to use so much more than I normally would to stay out to produce those effects. Marissa hears that, and she might also double dose her methamphetamine just on word of mouth. When in reality, likely my supply and Marissa's supply are not the same potency, my tolerance and Marissa's tolerance might not be the same. So big risk for overdose just hearing that the supply has changed in some way. The route of administration here is injection and smoking. That's pretty standard. It's kind of a 50-50. Methamphetamine users have a high rate of dual use or polysubstance use. And that means maybe using methamphetamine during the day to get through their work shift or through the day. And then in the evening, using a different substance to calm down. Alcohol, opioids, benzos. So it's a cycle of up or downer, up or downer. It takes a huge toll on the body. And next. Cocaine. Cocaine is the last drug we'll talk about. Cocaine is also a stimulant, also really tough on the heart and blood vessels. We're paying attention to cocaine because it hasn't been one of our top drugs in the last few years, but we're hearing an increased prevalence, increased preference, and there are more people injecting cocaine than they have in the past. Typically, cocaine would be snorted or smoked, but folks are IV injecting, again, additional risks with that. And you can be sure that a lot of the cocaine we see has some type of, or some presence of fentanyl contamination. And again, sometimes enough fentanyl to cause an overdose. So emerging substances, you can go for it. The first substance I'll talk about is kratom. And if you haven't heard of kratom, you absolutely will. Some folks are describing this as the fourth wave of the opioid epidemic, which might be premature, but that's how seriously everyone is taking kratom. Kratom in its natural state is a plant native to Southeast Asia. In small amounts, it has a stimulant effect. In larger amounts, it acts as an opioid. 7-OH is the alpha-lipoic part of kratom that is so dangerous. And in a natural plant, 7-OH is present in trace amounts. It's negligible. But the products we get in the U.S., tonics, tinctures, powders, pills, gummies, the 7-OH is synthetic, highly concentrated, and hyper potent. It acts as a full-on opioid agonist in these products. And that means both dependence and withdrawal mimic that of opioids. The difference with kratom is that it's widely available. You can get it anywhere. Gas stations, convenience stores, smoke shops, specialty bars like Pava bars, and lots of places online. We worry about drug interactions with all drugs and medications. Kratom is different because it's marketed as a health tonic. people are not perceiving it as a drug or a drug risk. That bottom picture, if you can see, is a little tonic called Feel Free. That is a Kratom Kava mix available here in Douglas. I've seen the gas stations here. So Kratom acting on our opioid receptor and Kava acting on our GABA receptor. So sedation plus sedation. And the effectiveness of naloxone was debated. There was mixed information early on, but we're learning that naloxone is really effective against a kratom overdose. So we recommend trying it. Anytime anyone has symptoms of an opioid overdose, it's always best practice to get naloxone. Medetomidine is the last drug we'll talk about. Medetomidine is another veterinary sedative, just like xylazine, except medetomidine is stronger and longer lasting. So it's an amped up version. On its own, it causes deep sedation and respiratory depression. It's cut into the fentanyl, which also causes sedation and respiratory depression. It's a double whammy of respiratory distress. It is not an opioid. Naloxone will not work on medetomidine, but because medetomidine is often mixed with fentanyl, it's best to try naloxone. Naloxone can act on the fentanyl in the system. And then to talk about what we do here, I'm going to start with our health department programs. The first is a naloxone distribution and overdose recognition and response trainings. We provide naloxone and we want to teach people how to use it. Because drug potencies are changing, increasing, routes of administration are changing, and because fentanyl is cut across so many other substances, we recommend naloxone broadly to everyone, not just folks who identify as opioid users. The next project is our Justice Involved Link to Care and Transport to Treatment. That's a partnership with our county jail. Inmates with a history of substance use are matched with a social worker while they're incarcerated, who can work on recovery, coping skills, goal setting, and a plan for reentry. Then at the time that individual is released, our community health worker is there at the jail to meet the individual, continue to connect them with services, work as kind of a case navigator, and also transport them to treatment centers, even centers out of county, Tucson or Phoenix. Working with this population is important because a lot of overdose fatalities happen 2 to 3 days out of jail, really quickly after someone's released. So we do want to provide that continuum of care that starts during incarceration and follows them as they transition to reentry. Also, the time between a person is incarcerated and the time they get out, the whole drug landscape can change. So we do want to be with the individual, offering the best information, education, and resources to give them the best opportunity. And our last project is the Overdose Fatality Review Board. This is a panel of experts that look at every overdose death that happens in Cochise County. Analyzing that information gives us real data. We can identify patterns, we can look at seasonal risks, and then we can turn that information into targeted prevention efforts. And it's not just the health department. We've got tons of people working on this. In Cochise County, we have a coalition called the Cochise Addiction and Recovery Partnership, or CARP. It's a multi-sector coalition of individuals working with every angle of the addiction and recovery sphere, we'll say. So having this network and collaborating so often with them gives us a great opportunity to share information rapidly, to share resources and supplies. We can also better easily connect folks to treatment because we know everyone at these treatment facilities. And then we can work as a team to kind of converge on areas where we see an overdose cluster or an at-risk situation. So I'm going to pause, Kendra, for a minute. If anybody's interested about joining CARP, they meet online. Kendra is one of the facilitators. It's great information. We can put Kendra's email in the chat. just email her and then she can get you on that list. If you can't attend every meeting, don't worry about it. If you can show up intermittently, it'd be great. Absolutely. And whether you show up one time or all the time, we will send you information. Thanks, Sandra. And then the next slide is, it's just an example of CURB in action. So from a fatality analysis, we saw that 1/3 of our overdose deaths occurred in summer. June, July, August, our hottest months, 1/3 of our deaths that year. Something about the heat that makes the body less able to tolerate these drugs. So what we did was present these findings to CARB, work together on a plan, which was going to include substance use specific heat safety and heat safety supplies. We were able to push out that coordinated messaging across partners, and then we set up cooling supply distribution sites to give electrolytes, cooling towels, Wiper hot, sunscreen, things that might help. And yeah, next slide. This is an example of the education, small print from here, but it breaks down most common drugs and their specific heat risks, tips on staying safe, signs of overheating, and other information. And I'm going to close with plugging our overdose prevention webpage on the Cochise County website. On this page, you can view overdose recognition and response videos, both in English and Spanish. We have an interactive map that'll show you all the places around Cochise County where you can obtain free naloxone. You can look at our overdose fatality reports, and you can find a list of local and statewide treatment resources if you know anyone in addiction looking for a little help. Thanks.
Thank you very much. I'm just kind of thinking that maybe this would be really good for you to give a presentation to the Board of Supervisors. Because I know Supervisor Cogg is really into, prevention and all that. And I think that in a conversation I had with Supervisor Antonori, doesn't realize that fentanyl is still a big problem. I think people's perception now is that maybe it's hard to get across, but I don't think that really is what the situation is. So I kind of really am amazed by what you guys do, and I think Supervisor Antonori and myself don't understand the huge, broad, what would you say, swath or rush that you do as far as it comes to fun. And I don't think the county realizes, residents of the county, just how much you guys do in all levels. And so I would like to suggest you guys come and give this presentation to the Board of Supervisors.
Is this training something you could do for clinical stuff?
Yeah.
Okay. I think that would be great for clinical stuff. I try to do like the overview and like make sure if you're administering naloxone, you should have gloves on and stuff, but I think like an in-depth training for them if they're responding to these situations within our minds would be a great idea.
Absolutely. We'd love to do that.
And excuse me, first thank you for information for training. And then aside from the CARB initiative, which is very interesting, and it seems that replace cross-sector partnership collaboration. But for community members, how can they know this information?
Get involved. We welcome community members into CARB if they'd like to join. When we have an additional an at-risk or a cluster, we do try to push information through sub-distributors. That could be our libraries, that could be behavioral health. But if you have ideas on how to better engage the public, I'm all ears. I'd love to try everything. Thanks.
We're going to talk a little bit about the measles today. I think everyone is pretty aware of the outbreak that we're having across the nation, but also seeing cases in Arizona. Max is going to focus on a lot of epidemiology and the cases that we're seeing increase cases in different lands. And I'm just going to focus on a pretty brief clinical overview, just give everybody a review and update on what measles is as a virus. Go to the next slide. So overarchingly, measles is one of the most contagious infectious diseases that we know of. It is highly transmissible. It requires a very high community vaccination threshold rate in order to prevent widespread outbreaks happening in communities. Illness will develop in 90% of people who are exposed and susceptible. Yeah. So for folks who are susceptible, this means they are either unvaccinated due to choice, so medical exemption, religious exemption.
Okay, here, the speaker, whoops. Here, I'm gonna try to move the microphone closer. There you go. That's good. Okay, try that. Okay.
Is that a bit better? Can you guys hear me clearly? Perfect. Okay. I'll try to keep talking loud, but just remind me if I'm not heard. So yeah, overarchingly, one of the most infectious diseases that we have for susceptible individuals coming into contact with the virus, 90% of those that are exposed are going to develop illness. That's how transmissible this virus is. The majority of infections due to measles are going to end in recovery, but there are complications, and those complications can be quite serious. They can be fatal. We'll get into that in just a bit. Next slide. So looking at the transmission of measles, one of the reasons this is such a dangerous virus is because it's airborne, and due to its overall size and ability to remain in the air, suspended in the air, makes it, again, very transmissible. So if somebody is infected with measles, walks into a room, those airborne particles are going to be hanging around that room for up to 2 hours. So that means that an infected person can come into a room and leave, and then for 2 hours, these particles floating around, other folks can be exposed to the virus. The majority of the ways that we see measles transmitted is through respiratory droplets. This is going to be if somebody is coughing, if somebody is sneezing. Those are those larger droplets that you kind of need to be, in closer proximity to in order to be affected by them. And then in addition to that, the measles virus can remain on a surface that is touched, so through contact transmission. So if somebody is infected, touches a surface, viral particles are on that surface. Somebody else can come along, touch the same surface, touch their eyes, nose, mouth, and that's the way that it is transmitted as well. So something that I think is really important to look at when we're talking about transmissibility of measles is the R0 value, which in epi is essentially the number of people who would be susceptible to a virus. So again, someone who's not vaccinated, someone who is immunocompromised, someone who's not old enough to have received all of their vaccines yet. So so with an infected person, how many additional people are they going to infect if they're coming into contact with susceptible individuals? First, in comparison, one of our most transmissible strains of COVID had an R0 value of 3 people. So for every one person with COVID, about 3 others were getting infected who weren't immune or weren't fully vaccinated, etc. For Ebola, that's 2 people. When we look at HIV and some of our severe acute respiratory syndromes, it's going to be around 4 people. Chickenpox is 10. When we look at measles, it's 18 people. So for every one person infected with measles coming into contact with susceptible community members, 18 additional people are going to become infected. So when you think about that at scale, as an outbreak is happening, that's not just one person infecting 18. Now 18 people are infecting, potential additional 18 people. This is different from what we talk about as the effective or functional reproduction value, and that's really looking at what is the vaccination rate within a community, and we do have, MMR vaccine coverage throughout our community. So it's not, in practice, not necessarily 18 people getting sick with every one person who has measles, because we do have some protective factors such as vaccination. All right, so just a brief overview of clinical presentation. We're looking at an incubation period of 10 to 14 days. And that signifies somebody has come into contact with the virus, they've contracted the virus, that it's that time period before symptoms start to show. Those early symptoms are going to be fever, runny nose, conjunctivitis. It's really easy to confuse these symptoms for other illnesses, so different respiratory infections, if it's flu season. Sometimes this can get passed off as allergies. The danger of that is if somebody, is thinking that they're just having a common cold or that they're just allergic to something, they're still out and about. They're in the community, they're at work, and if it is measles, they're potentially exposing other people. Another kind of specific sign to measles is going to be Koplik spots, which is a rash or markings on the buccal mucosa, so inner cheeks of the mouth. And after those early symptoms pass, you're going into the rash phase. So this is typically what we think of when we think of measles. It's that very specific rash, maculopapular rash, can start kind of along the hairline behind the ears and then around the face and works its way down the body, so down the trunk and down the extremities. The rash itself lasts for about 4 days, and it's important to remember that people infected with measles are contagious, they're infectious, 4 days before that rash even appears, and then for 4 days after that rash goes away. Other systems that measles infection can impact throughout the body. So your respiratory system, of course, we talked about some of those early symptoms. Your GI system, lymphatic system, and then measles has a really unique way of impacting the immune system. It can be quite scary when it impacts the immune system. So essentially our T cells and our B cells, the cells in our body that are responsible for remembering when we've been infected with something or if we've received a vaccination and now we have immunity for a specific virus, a specific illness, measles will actually attack these cells directly and at times can create a situation called immune amnesia. It alters your immunity. It can lead to your immune system forgetting the immunity that it has built to prior infections or even sometimes to vaccination. So with really young kiddos who maybe haven't been vaccinated against measles quite yet, but they have received other vaccines. So their hepatitis B, their DTaP, polio, etc. In certain situations following a measles infection, they're not going to have that immunity that they previously received from those childhood immunizations. And this doesn't happen across the board, but definitely in certain situations it can be clinically indicated to revaccinate these kiddos. That's the type of impact that it has on the immune system. That altered immunity is still being studied more in depth, but it can persist for a couple of years, 2 to 3 years. And while that's happening, that person is extremely susceptible to additional secondary infections. So if they're coming into contact with bacterial infection, another virus, their immune system is weakened. They don't have that same immunity that they once had from previous illness or vaccination. A few of the complications that we see with measles infection, the most common is going to be an ear infection. So about 10% of people who get measles will develop ear infections. It's common, can be easily treated with antibiotics. We also see about 8% developing pneumonia, diarrhea. Particularly globally, when kiddos with measles are having symptoms of diarrhea, this can be dangerous as we're looking at severe dehydration, which can be critical for a younger patient. In rare cases, but it is definitely a serious complication of measles, is brain infection. So you're looking at a fatality rate of about 2 to 3% of people who contract measles will come down with brain infection, leading to encephalitis, and then about 25 or a quarter of those survivors are going to have long-term complications. Really unique thing that comes out of measles infection is subacute sclerosing panencephalitis, or SSPE. This starts to occur when you are infected with measles, so if it's a kid, but essentially lays dormant and doesn't then present itself for years. So like adolescents, or looking at sometimes high school students who had a previous measles infection, fully healed, fully recovered, and then all of a sudden they're presented to the hospital with brain inflammation, and there is no cure for this. It is fatal. And we actually just had a high schooler or a school-aged child in California just last year, so September of 2025, that developed subacute sclerosing panencephalitis and did pass away due to previous measles vaccination, or measles infection. All right, so that's a lot of not great news about how scary and transmissible measles is. The really good news is that it is highly, highly preventable. The MMR vaccine, or the measles, mumps, rubella vaccine, is one of the most heavily studied and efficacious vaccines that we have. When we look at its efficacy, it's a 2-dose series. So typically, first dose being given 12 to 15 months, second dose being given 4 to 6 years of age. After that first dose, it's 93% effective, and 97 up to 99% effective after you've completed the series of those 2 doses. And not only is that effective in preventing, hospitalization, severe illness, and death, that's efficacy in preventing infection altogether, which in vaccine science, that's huge, that's incredible. When we think about our COVID vaccines, we're really looking at how can we decrease the number of people that are becoming severely ill from COVID, keep them out of the hospital, and keep them alive. We're not really preventing a lot of infection from COVID vaccines, etc. Just mitigating what happens to the body if you are going to come into contact with the virus. But this vaccine is so efficacious that we're really looking at preventing infection altogether. It offers a lot of protection for individuals and then for communities at large. The global death toll of measles before vaccines for measles were introduced was 3 to 4 million people. After vaccines were introduced and MMR was being distributed and administered widely, the global death toll was less than 150,000. So we're looking at an estimated prevention of 66 million deaths, which is huge. We are looking and seeing, different vaccination rates, specifically with MMR. It can be a politicized vaccine. Vaccination rates are declining. And like everything that we talked about before, with this being such a highly transmissible virus, the community threshold, that community immunity percentage that you're looking at, is quite high for measles because it is so transmissible from one person to the next. So you're looking at needing 95% of any given community to be fully vaccinated against measles with the MMR vaccine in order to really be able to contain any outbreaks that might happen or prevent outbreaks from spreading. That 5% is going to be, folks who have medical exemptions truly cannot receive the MMR vaccine. Pregnant individuals cannot receive the MMR vaccine because it's a live attenuated vaccine. We have immunocompromised patients who may not be able to receive it, or folks who receive it and just never mount that full immune response, even though they've been vaccinated, they're not fully protected in rare instances. But we are seeing a larger and larger growing percentage of non-medical exemptions, so that overall MMR vaccination rate slowly declining, which then puts our communities in a situation where they're quite at risk for outbreaks to spread easily. And that is what we're seeing across the states and within Arizona as well. And then I'm just going to end on this last slide, which I think is a really, really great visual representation of what the MMR vaccine has done for the overall health and well-being of the world, not just the country. So on the left, you're seeing skyrocketing measles cases. Our initial vaccine was introduced in 1963. You can see pretty shortly thereafter it's taking a dip in terms of measles cases across the country. Our current MMR vaccine that we have now, introduced in 1988, we were initially implementing that with a 1-dose series, and then we're seeing some breakthrough infections, so that's why it was transitioned to a 2-dose series. So you see that last little uptick before 1990 on the graph, and after that double dose was recommended, you can see just the complete drastic difference between what our measles cases looked like before the vaccine was implemented and after. This graph, of course, only covers up into just about after 2020. So if we were to look at today's version of this graph, we would see a pretty big spike in measles cases, which is going to coincide with a decline in MMR vaccination rates. Perfect. And then looking at vaccination rates for Cochise County specifically, this is from the 2024 to 2025 school year. For our child care age kiddos, they're only really eligible for that one MMR dose, because remember, we don't give the second one until 4 to 6 years. But for those who have at least that one dose, at that time, the coverage rate is 96.1%. This is great. This is above that 95% threshold that we like to see. Kindergarten, I've seen mixed data on this. I've seen some reports lately that we're looking more in the high 80%, but from this specific report, it was 92.3% who had the 2 doses of MMR. And then the 6th grade, with the full series completed, 96.4% as well. But these are declining, definitely in certain areas throughout the county. We are seeing coverage rates, in the high, mid, low 80s, which is very problematic if there's to be an outbreak. If one person is infected in that school and you have that, number of folks who are not protected against measles, they haven't received the MMR vaccine, it's going to spread pretty rapidly. And I think those are all the slides that I have, unless anybody had questions before we moved into an epi overview.
I kind of do. I'm going to be the devil's advocate. So when I had kids, I was living in New York City. This has got to be like, I guess, in the 90s. There was a lot of talk about the connection with autism. And I actually had, in the case of, we had a co-op childcare, kids who were under 5, actually saw a child that got the MMR, did get autism. And in the house, the children, it's a subcommittee, and I think it's called Families, Children, and Health. Dan Coates was the chair there. He had experienced these things. So what I ended up doing, and I'm wondering if there is not availability of this, I went to my doctor and she said, listen, what we can do is give that MMR separately. So the reason we don't offer that to families is because we're afraid that they won't come 3 times to get it, right? Is there a possibility that if a parent asks for it to be separated, can they get that?
So we actually don't have separate measles, mumps, and rubella vaccines. We have the MMR vaccine, which protects against all 3.
I understand.
And then we have the MMR-B. So that there's been some talk lately about the separation between MMR plus varicella, the MMR-B, and MMR. But with our current, we aren't able to get individual
and
vaccines.
that's just basically, and this is why I sometimes get upset with medical areas, that they want to make it so easy for you that it's easier for them to lump it all together and give it than to be able to give the parent that choice. I was lucky in New York City, she gave me a choice. She said, I know you come back, you want to do it separately. I said, I do, because there's just enough information out there to make me question if this is the best way for my child. And that's unfortunate, because we get into this, it's just so much easier to put it all in one. It's good for the pharmaceuticals, it's good for the doctors, and not given that choice. But I gather probably because we're a small community and rural, we don't have that availability, right?
Correct, but not just in Cochise County. So we don't, there aren't separate vaccines for measles, mumps, and then rubella. It is just the MMR vaccine. So it doesn't, even if we were in like a larger metropolitan area, that wouldn't be an option either. It's all a combined
So I was lucky to have been able to have a doctor that was able to do that for us, because we did get them separate. But that was back in the 90s, so. And I think part of the problem too is even though we say that vaccinations, there's just so many of them. There's, whether it's shingles or whether it's, measles or whether it's, chicken pox, whatever. I think people, especially after COVID and finding so many people got, we went right into it without really testing. I didn't get it. I knew I was healthy. The people that should have gotten it were people that, were compromised. But I think that really did a negative kind of, and this is the aftermath of having it, saying you have to have it, everyone's going to have it. I was told, when I went to Banner Medical, that I didn't have it, or you're going to die. I said, what do you mean? So there was so much of this craziness, and I think that is why some people are saying, wait a minute, I want to step back. I want to see what it did. And it's unfortunate that we don't have that separate. So those people who fear, or who maybe know somebody who had an after effect from the MMR, could actually, have a choice. We don't have choices, and that's unfortunate.
Yeah. I do think that the COVID vaccine distribution did change the vaccine landscape quite a bit. We have a lot of information and different opinions floating around, so I'd say my primary recommendation is if folks are feeling unsure about which immunizations they'd like to receive for themselves or their children, to really sit down and have that conversation with your primary care provider. Talk one-on-one with the pediatrician who's been seeing your kids for years, figure out what's best for you and your family. Any vaccine administration is always going to be shared clinical decision making, and it's always been that way. So nobody is, forced to get vaccinated. Those routine, pediatric immunizations, it's not forced upon anyone. We want to make sure that every patient, every parent of every patient is fully informed about, what vaccines their kid is receiving and has the opportunity to ask questions.
And what the side effects
are. Yeah, and to go through any potential effects that could have with the vaccine. But having that one-on-one conversation with your primary care provider or with the clinicians administering your vaccines is, I think, more important now than it has been. more than ever.
Thank you.
So in the chat, someone said healthcare inequality in the United States is a factor in combining vaccinations.
That's correct.
Inequality, is that what it says? I can't read.
Yes.
Okay.
Okay, next. Again, I'll be providing a infectious disease update in general. Our agenda for this presentation is going to be starting with measles. We're fresh after Emily's presentation. We're going to continue to those infectious diseases that were most reported in Cochise County for the year 2025. And then we're going to wrap it up with some other really cool stuff. I have a surprise for you all, which is our vector surveillance. And we'll get into the details once we get there. So, she just covered the clinical aspect of measles, but I wanted to cover what's happening in Arizona. We've probably seen it in the news that there's pockets, certain counties that have had issues recently with higher transmission rates or being at an alarmed state because they've detected maybe 1 or 2 cases and that can just spread like wildfire. Here, there's a few highlights. Cochise County, no cases for 2024 and 2025 and 2026. Statewide, we've seen a handful, 5. 2022, we didn't have any reported in the state of Arizona. But then let's take a look at 2025. It just went 44-fold as we were expecting in the previous years. And so far, a month into 2026, we've already had 24 cases reported in the whole state. Mojave County is having a big issue with measles right now. There's a community that just keeps reporting infections, and we'll talk more about those details in a minute. Both 2025 and 2026, the highest case counts come from Mojave County. But starting this year, we can also see that Pima County, which is the closest to us, Pinal County, and Maricopa County are getting ready to see those cases bump up and do their investigations accordingly to try and stop further transmission. Now we go next slide. This is the case count for 2026. So we started the year hot already, which is probably an indicator that it's going to keep that way. And at this point, all the different jurisdictions within Arizona are trying to get prepared, do their public messaging, saying, hey, we have the shots if you want it. These are the ways that you can protect yourself, if you're sick, don't travel, and so on. So there's multiple things that we should consider, not only when talking about health, it's not just a disease, but it's part of a greater conversation of being a human being. Well, what are your beliefs? What are the community dynamics that we get together, share the germs, share food, you know? And also our perception on health topics. We might be really concerned about rabies, but when we talk about these vaccine preventable diseases, we might think about it a little bit more into making our decision. So all these contribute towards the community's transmission rates. Here's a map. We did mention there was a hot pocket in Mojave County. It is up on the top left corner of the map, right along the edge with Utah. There's a small town called Colorado City, and this is where majority of these cases are being reported from. It's up there by the Grand Canyon. We're all the way across, which is good news. We're kind of geographically separated from the hot pocket. But we must be careful and be ready because we're very close to Pima County. People from Cochise travel all over the place for work, for families, for shopping. So at any of those points, we might bring it back. So we're ready. Hopefully, we won't need to respond to any measles cases within Cochise, but we have had a few scares previously. Yeah. So for the Mojave County, yep. Okay, let's get into why is Mojave County so high. That's language. So this community is very frame it. Well, the community itself has those characteristics that we just talked about maybe religious exemptions, kids are not being able to get vaccinated, especially those that are multi-dose, like with MMR, there's 2 of them. Certain groups might prefer those shots that are come only 1 dose presentation and that's it. There's a lot of that younger population in Mojave County, this particular city, that might not have any MMR by the age that they're at. So 67% of the cases are under 18 years, which kind of tells us, well, if you're 5-year-old, you should have received at least 1. But what if it happened because of personal beliefs, religious exemptions, and so on? So a lot of these factors start trickling in to this disease transmission in Mojave County. And here we also see that 97% of them were unvaccinated or under-vaccinated out of those 239. And on the bottom, it started in August, and we can see how the cases have not really declined. It's just a continuous transmission into 2026. We're done with measles. Let's take a step to the side and talk about those diseases or reportable conditions that are coming in at a higher frequency to Cochise County. So every year we pull the data, analyze it, and come up with the top 5 diseases for Cochise County. And as you might expect, these are your respiratory viruses throughout winter. People are inside the house, sharing those viruses such as COVID, which was number 1 being reported to the county, followed by influenza. It was a pretty heavy season that we just went through. And RSV, those are the top 3 respiratory viruses that we see. But then we also see CAMP, which is number 4. That one, that's foodborne. We get it through improperly handled foods, improperly cooked foods, leftovers being left outside of the counter, and then people next day come by, eat it, and no surprise, bacteria had already started growing in that food. And then the last one, we've all heard about it, California, Arizona have high rates of valley fever. That's a fungus that we breathe in the spores, and then it starts affecting your system, your lungs, and that was number 5 out of the top reportable conditions in Cochise County.
Yes. So is that camel, I can never say is that basically food poisoning? A different term for it, or not the same?
It's a foodborne infection. Poisoning, we categorize it as, is there anything else such as toxins growing on the food? Toxins are a little bit different because there are products that bacteria put out, but this one is the bacteria itself causing the infection.
Would you happen to know off the top of your head if our RSV cases did decrease from 2024 with the use of the vaccine?
I'll get you that information.
Okay. I just wanted to know what the introduction of that vaccine if it decreased our cases. Or I guess it's not a vaccine, immunization.
Oh, yeah. There's made a comment saying one of the primary barriers to vaccination in the Mojave County. Just talked about vaccine.
What is she stating? I'm sorry?
That vaccine hesitancy is one of those factors that are really affecting Mojave County right now.
Okay.
She would iterate.
And they're they have quite a few Indian tribes too, which have different outlook towards vaccinations and, like you said, religious.
Okay, next slide, please. Okay, this graph is not going on. It's the same type of conditions we're talking about. Yes.
We do see quite a bit of vaccine hesitancy across Cochise County as well. We tend to see higher prevalence of hesitancy in more rural areas, and I think the specific location in Mojave County is a bit more rural than but just different beliefs.
Yeah. Okay, going back to our case count for the top 5, here's a comparison. Maybe that can help answer your question. It's staying relatively the same for RSV transmission, and these are only cases that are confirmed by a lab. Maybe there's more out there in the community, but people maybe didn't get tested, and as a consequence, did not get reported. We see a huge drop in COVID. Maybe people are getting more acclimated to it, like we're used to it, and maybe not getting tested and just get well at home. That would be something that's affecting such a huge difference of 43% drop. Influenza did grow, maybe because the symptoms this season were a bit stronger. You get a little bit more worried, and then you go to the ER and get that. But also, this is good, which I've seen a lot of those provider networks test for it. Maybe in the past it wasn't a standard, but now most of them are actually running those swabs and detecting these cases in addition to whatever they are showing up to the clinic for. And then the last three didn't really change much. Anything that changes at about 5% is expected as normal, fluctuations in disease transmission. Anything greater than 5%, you might start thinking about those other factors that are contributing to the change.
Hey, Axel, can I just, on the Campylobacter part, can you touch a little bit base too, though, on that it's foodborne or food related, but can you also tie into where it can also be because people have backyard chickens and they're washing their eggs that they get from the chicken, not properly cooking the eggs maybe all the way through, and that those also are a factor that play into the numbers with the county, that it's not necessarily coming from you eating at a restaurant, because that's what automatically people assume whenever you say foodborne. But it is a lot of factors of improper hand washing and things in your own home as well.
Yeah, let's talk a little bit about Campylobacter. As Natalie just mentioned, when we get sick, most of the times we assume it's the last place that we ate at. Well, it's not always true, depending on what it is, like Salmonella and Campylobacter. These take maybe a day or two for those symptoms to start showing up, because the bacteria itself has to reproduce to enough numbers to make it sick. If it's a toxin or norovirus, the onset time is real quick. You're going to start showing those symptoms within a few hours or even minutes, depending on what it is. With Campylobacter, backyard chickens in some of our investigations do show up, maybe because of all that matter that's on the exterior of the shell. It might still be fresh. We might be cross-contaminating our kitchen, putting our hands in our mouths. And also, people wash the egg. Some people do. And that creates like micro pores in the shell egg. And that way, Salmonella can start being exposed to the outside environment and then start growing and coming into the egg. And there's a kill step involved when you scramble your eggs to the right temperature, but many people like their eggs undercooked, runny, and that's when the perfect conditions start lining up for somebody to get these type of infections.
So don't wash your eggs?
Don't wash your eggs and cook them all the way.
That's right.
Unpasteurized milk is another one. There's a higher risk associated to campy infections and Salmonella with consuming pasteurized milk or raw milk. Personal decision, just know your risk whenever you're consuming anything.
Thank you.
Thank you. Okay, the fun stuff, the surprise one. This is the last portion of my presentation. And it's one of those that maybe the community doesn't know that we do, and it's vector surveillance. That means we keep an eye on all those non-human species that are able to transmit disease to humans. Humans is our focus and health department, but we collaborate with USDA and other partners out there to see, well, what's it looking like in the non-human species. With rabies, that's one of our problem areas, let's put it that way, because over the years we've been getting more and more positive rabid animals from Cochise County. These include foxes, bats, skunks, coatis, everything that's in here. And the reason why they're tested is not fun, but because it probably got into a fight with your dog at home. With yourself, we've seen that people have had issues with wildlife and being scratched or hit. And as a result, animal control is called over, they pick up the animal, and then we coordinate the testing and certification of all these animals. The fox in our site here, he was a volunteer from Hereford, and he tested positive for rabies. Not only Cochise County has seen an increase in rabies lately, but the whole state of Arizona is, which is one of those topics that we all chat about when we have meetings. How can we improve communications or processes? Last year, if you follow the county Facebook page, you might have seen some posts regarding West Nile and rabies, because we had a heavy campaign to educate our communities on the risks and what to do and what not to do.
And don't feed wildlife. We have a public service announcement. Don't feed wildlife because you put yourself and your family and your pets at risk.
Sure. So I wanted to provide a map here. All these symbols in the map of Arizona are the different species that have tested positive, and this is for 2025. We'll see a very dense pocket in Cochise, Pima, and Santa Cruz with a bunch of stars. These are skunks that have tested positive. You know, skunks tend to scratch at your street in the backyard, or if they see food, they might try and get it, like your pet's food or whatever. So there's a lot of those down here, but we also get some foxes and coati, bobcat, bats. So yeah, lots of wildlife in southern Cochise County, southern Arizona. Okay, moving away from rabies. Hot topic, West Nile last year. It was the first time it was detected in Cochise County, and there were lots of notifications made. And we ended the 2025 year with 3 positive traps. So we set the traps for mosquitoes overnight, and then we'll separate the mosquitoes, make it into a slurry, and test it for those diseases that they may transmit. One of these being West Nile virus. No human cases, yeah, 3 positive traps. So education, prevention starts kicking in, maybe considering addressing those sources, such as in the picture here, around the park we had some puddles and broken pipes that were attracting the mosquitoes and allowing for breeding grounds. And we also have a map with red dots. That's where the traps tested positive for. 2 down here on the border of Douglas and 1 on the western end of the county.
This actually, just like for the people in Douglas, it was at 3rd Street Park. It was down by the airport park, which, you know, there's a lot of kids all the time because they had so much standing water. They don't have a good drainage system. And then Perterville was another one. So by working with the city, we got them to, you know, drain those areas. And now, as we will go forward, we'll make sure that that kind of stuff doesn't happen. And I think the city did become very aware of, you know, how much water, because we did have a heavy rainy season during that summer months, but how serious it was. Because, you know, you think, oh, standing water, you know, it's going to go away, but testing positive, and the numbers were huge, were really big. So I think the city, when the county helped them and we made like an alert, it got out to the community to just stay away, cover yourself, or just use, what is it, DEET or PEET or whatever, right? DEET. But I was unnerved by all the how high the test was, showing how many mosquitoes were, not just West Nile virus, but some of the other diseases they carry. There were a lot.
And just so you know, we do have communication with our health partners in AP. They did have a very heavy junk collection campaign. Supervisor Gomez here put the Goodwill waste collection campaign as well. Thank you. Some of the symptoms associated to West Nile, most of them are going to be very mild, but we always have those susceptible groups in our communities, immunocompromised, children, their immune system not having developed yet, or the very elderly. They can start getting some of those severe symptoms, such as maybe muscle weakness, coordination issues, which would lead to a coma, falls, and worst case scenario, I don't want to scare anyone, but the most severe consequence would be even death of a person. There's some maybe West Nile transmission in the central region of the state, so if you go out there, make sure you wear your bug repellent and all that good stuff. Next slide, please. And the last one I'm going to cover here. Kissing bugs.
It's almost Valentine's Day.
Yeah.
Good transition.
Perfect here. So kissing bugs, they're present here in this area. Most of those samples that we received came from the Bisbee, Douglas area. And yeah, they'll take a blood meal out of you. Most of the time, bathes while you're sleeping. This horror stories come around like kissing bugs. On the left, we have an unfed one. And on the right, we have a beautiful, just these two samples were processed by Cochise County. We got them here, we sent them for testing. Why are they important? Because they carry a parasite, which is pictured on the bottom, which is a trypanosome. It's this like really cool word that flies into your blood system. It's going to end up in the heart and then cause inflammation and scar tissue development, and it could be deadly. Good news. It's not very well established what the proportion is for these kissing bugs being infected with the parasite itself. Those samples that we get here are because they've bitten somebody, like in their bed. They find the bug and then they bring it over for testing. But the patient themselves, they can go to their provider and have some labs ordered for the antibodies that develop after being infected with the parasite itself. So there's those two aspects. The human labs that can be ran by the providers, and then we'll test the bug. We do notify the patients what the results are once we get them. It takes a longer time than it would going through your provider's lab. Okay, next slide. Okay, I think that concludes the presentation. I hope you enjoyed it. If you have any questions or want to discuss anything, please bring it up.
Why do you think, I remember the kissing bug was something I heard when I was maybe in my 20s or younger. How come all of a sudden now, it's just because warmer climate, or do you guys have any idea?
I think you hit it right. Climate change is affecting not only kissing bugs, but mosquito activity, rabies with the drought. It can be considered like a factor that's way beyond our control at the local level that is affecting our local response to some of these activities we've seen with the droughts, especially animals
Coming down, yeah.
Yep. Same with the bugs, it affects their behaviors, where they're at.
Okay, thank you. Thanks, Axel.
Thank you. Thank you.
For facility reporting, nothing to report. So that would be any of the Sharps injury occurred, any infection control concern, nothing has taken place across our clinic, so nothing to report out.
Great, that's good news.
That is
good. So now we have member concerns. Axel, I wanted to let people know, it's amazing that when in my first meeting, I realized that the health department also has screw room trucks, and just recently, I guess the screw room has traveled up to Sonora, right? I heard that. Is that true or not? Not yet.
It's Nuevo León, which is the closest state.
Okay, Nuevo León. So recently, I don't know if you guys remember, some of you are too young, but in the 70s, they had a screw room facility at BDI and were really quite successful in eradicating it. So there is a facility in Texas that is, I guess it's what they do is, I'm not sure what they are, but what we might have at BDI is a distribution system where the flies, the larva comes in, they radiate them, I guess is what it is, or do something to the larva, and then box it, and then send it out, and it gets dropped in different areas. And it's a sterile fly so that they cannot, the screw worm can't be transmitted. And it's a pretty awful disease for the cows. And this is a big concern because as this new commercial port opens up, Sonora, their main export, one of their biggest exports, one of the main ones for throughout the world is cattle, is meat. So that is going to be a really problem if the screw worm actually spreads. We're going to see that the border will be closed to having the cattle come over. So I'm hopeful. We toured the BDI facility about 3 weeks ago. Haven't heard back, but I'm going to be going to DC, and I talked to the Agricultural Department in Arizona. They're trying to push for us to have a screw worm distribution center here at BDI, which would be really beneficial for the cattle industry, both in Arizona and Sonora. So I'm hoping that that happens. And do you have any update on the screw worm?
With the screw worm, there's open funding by USDA, which just got pushed not long ago for applicants to start wrapping up those programs. I know USDA right now has 7 traps along the area looking for screw worm just in case they find it. Yeah, although we know it's not here yet, it's just a matter of finding it if it is. And the female screw worm fly only mates once in her life, so if you get those sterile males flying around, chances are higher that they're going to be mating with the female fly because it's once in her life, and no more screw worm keeps
coming through.
Yeah.
But it's an awful disease for the cattle. It's terrible. So that's kind of something new that happened for the screw worm. And hopefully that's, will provide some jobs for a while, but I'm hoping to get that done. Congressman Siscomani, and I'm going to talk to Congresswoman Grijalva and asking them to support us getting that funding and be able to have a distribution center here. And then, because I'm pretty transparent, and I know that some hospitals are not going to be happy to hear this, but I'm working very hard on making the hospital here in Douglas, like we had for 102 years. And one of the hardest things is land, and I'm 100% on the way to making sure we will be able to get land for a hospital. I'm talking to several different hospitals that want to get a foothold into this community. And then, of course, funding, which will take a little bit longer, but I've got the pathway to doing that. So my next step is to set up a committee of medical professionals to start helping spread the word and build a coalition. Because Douglas is, again, I'll say this, is the second largest community in Cochise County, 16,000 people, with bordering out Prieta, with a new commercial port. One of the things is that this Board of Supervisors is really strong on is economic development. And we cannot do economic development for this community because the two things people ask about are schools and our hospital. We were supposed to be a retiring community, for the retirement age, but let me tell you, my father just passed, and I talk about this a lot because he waited, it was 8.5 to 9 hours at the CR because he could not get transportation out. There were both, the pilots had called in sick, there was no backup plan and no ambulance could come. And it wasn't just him that day, a friend of mine, my mother-in-law, had the same situation, went in at 2, didn't get out until I think it was close to midnight, had been intubated, ended up dying. And there are several, I can name, that I know personally, 10 people who had that same situation. They're waiting too long for transportation. When we had CMAC out there, we had a helicopter pad and we had an ambulance. And when one helicopter left, another one came. I don't think that level of diminished, maybe even increased. So the need is really high for our community. And going 30 minutes away, if people were telling me, can you take him to Bisbee? Get him in a car and take him to Bisbee. He's 93 years old. I can't, disconnect him for everything. And so no, I couldn't. And because we couldn't get him to Bisbee, he passed. By the time he got a helicopter to come down, it was just like the doctor said, they didn't even know where to start. And he's not the only person. So I think that experience that I had in November when it happened November 3rd just gave me more of a passion to make sure that this community gets a hospital because there's no way we can grow unless we have one. And back in the day when I was working for CMAC, besides the fact that the Border Patrol had owed us $10 million, we had so many clinics coming. We were even thinking of going into cosmetic surgery, which is a real money maker, because we were just doing so well. So there's no way anyone's going to tell me that this community cannot support a hospital. I get a lot of discussion, well, who are you going to get to work? We didn't have that problem when we had the hospital. We did have problems with doctors, but through the GS3 or something, we had Dr. Masad, who everyone loved. We had the ability, we had gotten different doctors like Dr. Spooner, who really want to go into a rural community and tired of the big urban areas. So that is not a reason to not have a hospital. I am adamantly, I am so sure that this can happen. Once we get the land, it should be happening in about a month or two. Then I believe things are going to roll. I'm talking again, going to DC and talking to Cisco Monty's office because he sits on the appropriations committee. He's part of that big, rural health bill. So there are ways to do it. And so that's just kind of what I want to report because that's one of the passions, that and making sure that this commercial port is an open and transparent port. We're going to set a new Port of Authority board. That's key. If everyone has a seat at the table, and that's even the county health department, because health is a big issue, whether it's for people or whether it's for cattle. We want to do medical tourism. So there's a lot of things that are going to happen to benefit the community because if we don't do this, this community is going to die of life. We're just going to look at downtown, and that's because we don't have that economic stimulus. So when you talk to people, there are a lot of people who have moved here, don't want to see anything done. Oh, you can't use water, you can't grow. I bought my land on the internet. I'm from Alaska, and I don't like flies and cattle. Well, you shouldn't have bought in the agricultural zone. You shouldn't have bought out in McNeil. You shouldn't have bought it out in Double. We're still, people who say that the cattle industry is a dying industry aren't realistic. People still like hamburgers, they like meat, and that's just the way it is. And we have 150, 200 years of tradition of cattle. So there's a lot of people who would like to see things like just natural habitat and know people, but these are all people who have come to our community and have made their money somewhere else, buy their $500,000 homes, and then want nothing to happen. So that is going to be the struggle for us coming forward is, yes, we can use water if we do it wisely, but we can't say we can't grow because of the so-called lack of water. It's who's using it and how it's being, legislated. So again, I just want people to know that because I'm very transparent, and I want people to understand what my passion is here. And I think I am just amazed. I have to say it again by what your department does. Your department does everything. I remember one time, I I went to a restaurant in Douglas and they didn't provide water. And I'm thinking, they want me to pay for it. So I called Barbara, I said, is that something that's legal? Because I've never heard of that. She goes, no, they have to provide water. So we went to this restaurant and said, hey, look, I know you want to make money and I understand, but water is something if someone's choking or they don't want to pay for sodas, you have to provide water for them. And then food poisoning and just from the schoolroom and from everything you do, whether it's drug prevention, and it's just amazing. I still don't think I know everything you do. So I want to give you guys a really good credo for everything that your staff does. It's amazing.
Thank you. You've been a wonderful advocate, and we do quite a bit. And you know, you all are very lucky to have her definitely going to bat for Douglas because she has a very large commitment and passion for this community and the other communities that she serves. Dr. McLaughlin, I thought I saw your hand up. Did you have a comment or question?
Oh, it was so long ago. It was about the irradiated mosquitoes.
Mosquitoes.
But that was it. It was, I heard the mention of irradiated insects. Just wanted to chime in. Los Angeles County actually did a wonderful pilot program on that at the end of 2025, where they released about 600,000 irradiated male Aedes mosquitoes because of their fear for dengue fever. And they observed about an 80% decrease in dengue activity in the mosquitoes because the male mosquitoes were sterile and they couldn't produce offspring when they mated. So that just dropped all the mosquito population. It's a very common, wonderful idea. Happy to hear people are learning about this.
Thank you. Charlotte, you had a comment or question?
Hey, everybody. Actually, I just wanted to share some really good news with you. Northern Cochise Community Hospital is on board with your age-friendly health system movement that you talked about last month.
Yes.
And we were just recognized as a level 2 status, and we are currently the only critical access hospital in Arizona with this designation. So here in Cochise County, and I just wanted to tell you that, Barb, because I'm so excited about you doing this through the whole county, and super happy that the place that I work at is the first one to have that designation. So, and I also want to,
that's wonderful.
Thank you.
Well done. So one of the things I talked about at the last Board of Health is an aging initiative. It's really about taking away the stigma from growing older and really using positive terms. I always say now advanced age. I think the word elderly is a rough term. Some of my younger staff kind of said, hey, there's this old woman in the lobby, and I'm like, I wasn't in the lobby, but anyway. So really kind of reframing these terms and making sure I'm going to be working with the local co-op to get fresh produce in the skilled nursing homes, which I'm very excited about. Partnering with ASCHOW to really get the education out to our folks that maybe don't know how to use a computer, do some classes to really support them. I know the board's on board with recognizing our advanced age populations. Cochise County, we have a lot of folks that live here that are above 55 years of age, and we want to honor them and respect them and make sure they keep their dignity. And so figuring out ways to do that. So I applaud the hospital in Wilcox for getting the ball rolling. Cochise County Public Health is working on becoming the first public health organization in Cochise County that got an aging-friendly designation or certification. So I'm excited about that. So there's going to be more coming. I just wanted to kind of wrap everything up. I'll have these Here's Health flyers if you all need any more. I'll have Taryn put my email in the chat, and you can email me for those. Also, we'll put Kendra's email in the chat if anybody's interested in joining CARP or getting on those invites, and you can go when you can. Members, that's for professionals, students, you name it, anyone is welcome. And then the Justice Care Collective in Douglas, probably about 90 days. So I'll make sure we send out information to everybody. I notify folks, anybody interested is welcome to come. It'll be right here in this building. And then, as Supervisor Gomez said, works regarding Douglas Hospital, getting people together, she'll be facilitating a committee. And so lots going on in the county. If you ever have any questions or concerns about healthcare, want informational education, you can email us at publichealth@cochise.az.gov. Taryn can put that in the chat and we'll respond to any questions you have.
Before we end it, does anyone have any questions that you would like to bring up?
Oh, Charlotte, you had a question or a thought?
I have one more thought. I don't know if
Okay.
you guys noticed. I'm wearing red. Today is National Wear Red Day from the American Heart Association, and especially coming from a family who has a high rate of heart disease, I just think it's really important for people to be aware of that. Cardiovascular disease is the #1 killer of all people in the world globally. So take care of yourself. Take care of your heart. I just had to plug that. Thank you.
Oh, I appreciate that. So eating healthy, drinking plenty of water, and keep moving. This is a beautiful area. We have lots of trails and sidewalks and places to hike. So get out and enjoy the weather, right? If you turn on the TV, Michigan is getting hammered with snow, and we're out there, with our sun visors and our bottled water.
And one thing I'm thinking in sitting here and talking to everyone and realizing the needs of Douglas is maybe we can think down the road of doing some like a town hall health town hall meeting or something where we could do it like either on a Saturday or like say maybe later in the day and get all the organizations that deal with health, because there's a lot of them in Douglas, and have them come and do a presentation of what you guys are doing so good and how we can communicate better. And then I'll talk to the mayor, and he probably has some good input to radio stations in Alpharetta, and so that they could also talk about the Stanley Park and some of the things we're doing, because I really think that that's something we need to do, is be able to get more people at the table, more organizations talking to each other, especially talking to us in the county. So, if you guys have any ideas, my email is real easy. It's kgomez@cochise.az.gov. So, if you have any ideas or other organizations that we can bring to the table, please let me and Barbara know. Okay? I guess that's it. We close the meeting. Thank you all for being here. And our next meeting will be
Friday, April 3rd at 9 a.m.
Okay.
And the location is to be determined.
Okay, thank you all so much.
Thank you.
Have a great day.